Doctors are sounding the alarm about a troubling trend they are seeing, and it's an increase in colorectal cancer cases in young adults. Joe Ripley joining us now with this story. Some startling numbers here, Joe, and I guess it kind of all comes down to early detection.
That's right. It makes the difference, Dan, when you're talking about survival odds in this. About 150,000 patients get diagnosed with colorectal cancer each year in the United States. About a third of them survive, but it comes down to early detection. What's so troubling and alarming about this, though, is the number that's increased in the younger adults that are getting colorectal cancer. I spoke with doctors over at Piedmont Healthcare, and they were saying we are noticing a 2% increase in the number of patients that are getting this colorectal cancer at a younger age, less than 50 years old, right? So I spoke with Adam Keating, who's 41 years old. He said he ate healthy, he did everything right, he exercised, but a bombshell diagnosis ended up changing his life. Adam Keating lives for his family, seeing historic sights and hitting the high seas with his wife Lauren and their 2 kids.
Family is literally the linchpin and pinnacle of my life, the cornerstone of my life, along with my faith.
His family and faith kept this 41-year-old going, even when something inside felt wrong.
And this is the last thing I thought I'd be having to worry about the first quarter of this year. I'm active, I'm healthy, and it kind of took me by surprise. You know, I had symptoms, I'd say, the last 6 to 9 months, some changes in bowel habits.
After seeing a gastroenterologist, Keating got a colonoscopy.
They found a egg-sized tumor in my colon, and it was removed about 2 weeks later.
Surgeons had to remove the tumor and 10 inches of his colon, which would not have happened had Keating not gotten a screening.
30 years ago, about 11% of all patients with that disease were under the age of 54. Now it's up to 20%.
Dr. Wally Curran, chief of oncology at Piedmont Healthcare, says 150,000 people are diagnosed with colorectal cancer in the U.S. each year. Despite advances in care, about a third of those patients die from the disease.
Any blood in the stool should alert a call to your physician. Change in difficulty in evacuating, change in the appearance of your stool.
Keating has to undergo yearly colonoscopies now, but that pales in comparison to getting to spend the rest of his life with the ones he loves.
It narrows your focus 100%.
So the recommended age now to get a colonoscopy is 45 years old, though if you're at a higher risk, maybe you have family history or you were exposed to radiation, doctors are recommending you get screened much earlier. And this is staggering, too. Dr. Curran was telling me about 60% of people in Georgia who should be getting screened are getting screened, but there are still 40% of those eligible for colorectal cancer screenings who are not getting them.
I wonder why. I mean, you know, there are jokes about the colonoscopies and
right.
You know, dreading whenever that day is going to come. And I'm not there yet, but if it can save your life, you do it. And I don't know, maybe does it come down to insurance for some folks too?
I think so. I mean, I think cost is a big part of it. I mean, I know there are some coverage options available, but when you're talking about a matter of life and death, is that something you really want to procrastinate on or wait for? If you notice something is off, you want to get it checked out. I mean, it's one thing if I think you're feeling healthy or, you know, it's a blip, but if you're noticing consistent changes like Adam was for months, that's a sign. And credit to him, he said he had to put his pride aside. Credit to his wife Lauren, who said, you know, you really need to go get some things checked out, because I don't know about you, I'm typically one to kind of, you know, let things ride, let things go until it gets really bad, but that's not something you should do in this case. Doctors, doctors are saying like this could pop up. You don't have to have a family history necessarily. I think there's still some debate over why this is happening in much younger adults. A lot of folks think it's diet. A lot of folks think it may be more exposure to things like radiation or whatnot on construction sites, but this is something that is going to be tracked for a long time, but it's certainly troubling to see. I think, though, we don't want to scare people here. We want to advise people to check with your physician. Make sure you're getting those regular screenings if you're eligible and you think something is off. This is something that is preventable if it's caught early.
Yeah, and I mean, you don't have to wait till 45. I mean, ask your doctor if you think something's up before then. This man you spoke to is 41 years old.
41.
All right, Joe, thanks. Thanks for putting that on our radar.